As Lori Waffen-Schmidt in the newsroom just shared, Luigi Mangione is accused of killing the CEO of United Healthcare, Brian Thompson. He was charged on murder tonight. They found him today in Altoona, Pennsylvania, and they think they got their guy. He's officially charged with murder. That was notified. That was one of the push notifications we called on our WBAP app about 15 minutes ago. So if you don't have the app, I encourage you to load it. You can use it to listen to the radio station. You can also go back and listen to podcasts. So if you don't have the app, download it. Go to your app store, search WBAP, download it. It's a free app, and you can set it to get the notification. So when news breaks, you'll catch it on your phone as soon as it happens, and then we'll cover it on the air. My name's Jeff. It's Westside Jeff, in for Chris Kroc. We're talking tonight about the United Healthcare story. It's interesting, as I follow the story, the assassination of United Healthcare CEO Brian Thompson has opened the door to a national conversation about the role of health insurance providers play in health care. There's a real frustration going on across the country today from employers, employees, retirees, government, even medical providers. Talked to many medical providers that say that too. The U.S. is spending, we're spending $2 trillion more in healthcare than in 2010. And the reason I say 2010, that was before Obamacare. Yet Americans aren't getting healthier. We feel we spend more and we get less. Everybody seems frustrated about it, and this is opening the door for a national conversation. My question to you is this: how do we fix the system? How do you get over the frustration? What are some of the steps? Give me 1, 2, 3 solid things we could do differently. Who can do what differently to improve health care, health insurance, make it accessible, make it affordable? I know this. Jeff is my name, Westside Jeff. I'm spending the percentage of my income that I'm spending for health insurance is about triple what it was in 2010. My deductibles are about 5 times as high as they were then. My selections of doctors and healthcare providers is half of what it was then. It clearly is not better for me than it was in 2010. I'm employed by a private employer, so I'm not on Medicare and government insurance or Obamacare. It's my private employer. It's our health care providers are better than ever. The ability to save a life is phenomenal, but there's problems, and I don't know how to solve those, and I'd love to hear your perspective. Like Chip from Florida. Chip, thanks for calling WBAP. You're on with Westside Jeff.
Hey, good evening. A lot of your callers are making some rather intelligent comments, but it seems to be everybody's missing the 600-pound gorilla, which is the cost of litigation involved in both healthcare, treating patients, and with drugs. We all drive down there. I haven't been to Texas in a while. We had a solution to Obamacare at the hospital I worked at in the Chicago area, and so we closed the hospital. We literally shut down a level 1 trauma center because we could not stay in business. And the reason was Illinois, for instance, has no limits on one of the damages. I apologize. The word misses me right now. Compensatory damages. Yeah. So you end up seeing these multi-million-dollar cases, including the Vioxx and Celebrex for almost the same thing, but Vioxx got penalized almost $1 billion. Now, if Merck, for instance, sells a drug outside of the United States, they don't need to worry about getting sued. More so when they're sending it to Canada or one of these socialized nations, because if you're lucky enough as a patient to receive the medicine, you can't sue anybody. And the emergency room I worked at, we would have patients come in, and their first words were, "I'm going to sue." Literally their first words, "I'm going to sue." So people are living these negative lifestyles. They're smoking and drinking and doing all kinds of terrible things to their body. And when they have a bad outcome, they need to sue somebody. And the highways are full of billboards saying, "Hey, let's sue."
Sure they are.
So until the government comes down with some kind of a limitation on, and Canada has a term called the RVU. It's the relative value unit. Like, what is your value as a human being? Does your value necessitate us saving your life? And in the United States, we don't play that game. but potentially, I mean, and we see it not infrequently with even neonatal NICUs, where we're spending $300,000 a day trying to keep a 1 percentile child alive, who I hope they live, but if they do, they won't have a fruitful life. And I know that makes me sound like a jerk, but at what point do we as a nation say no? Like, I get everybody wants to be omniscient and omnipotent and live forever, but it's just not humanity.
Chip, you said Canada has a term. What is it, RVD?
RVU. It's the relative value unit. So
I'm writing this down. Relative. Go ahead.
So we've heard the stories of somebody at Mayo Clinic up in Rochester, Minnesota, and up north, and even here in Central Florida, we'll get Canadian patients all the time cash paying for a treatment, because if they don't cash pay in the States, they will never have it in Canada. They know that they will not get the treatment soon enough to save their lives. So what we're seeing now, and you've seen it, for a primary care, more primary care physicians, family practice doctors, pediatricians are doing more of a concierge health plan, where, remember, like, you used to go to the dentist and you have to pay the dentist, and then you can submit the bill to your insurance company, and maybe they'll pay you back for your dental care. And people got used to that 25, 30 years ago, that your dental insurance just didn't work the same way as health insurance. But the dentists, they knew they were getting paid. So we're seeing more of that in primary care. But, for instance, I worked at a hospital in Chicago, gun-free zone. I mean, absolutely gun-free. It's illegal to own a gun there. So we only got 3,300 shootings a year of gang members. And you know how many of them ever paid their bill? Ever? But they would sue us. None. So we had a guy was shot and stabbed, and from prison sued the doctor because the doctor did not realign his gang tattoo from his stabbing as well as he maybe could have. So the jury did not get to hear he was in prison. The jury did not get to hear he was shot. The jury did not get to hear he was a gang member. All the jury knew was the doctor didn't spend the time to realign the tattoo. And the jury awarded that guy a couple $100,000, and he's in prison literally for the rest of his life.
Well, you're sharing something I said earlier, and that is I think the cost of litigation is driving part of what's going on in healthcare, right? Is that, in essence, what you're saying?
Absolutely. That's 90% of the cost of running a practice anymore, unfortunately, is healthcare. And you have to remember, United and all these other big companies, they're also providing us with their medical malpractice insurance. So they're not just insuring you, they're insuring the doctors, the facilities. There's big clearinghouses in the back. So when they say $1 billion in profit, that just means they haven't had their latest storm. The last storm being COVID, where the government decided to pick up everything and redefine the term vaccination.
So how do you fix it? What do you do? What are some things, meaningful things you could do to fix that litigation issue? Limits on compensatory damages. No more of these $1 billion Morgan & Morgan claims. Or, you know, if you take Vioxx and drink a quart of vodka a day, it's going to shut down your kidneys. Well, no kidding. And we see that, you know, the Villages, Florida is a great example where these people, they'll say they're a social drinker, which means a quart and a half of whiskey a day. And they're on every medication under the sun. Yeah. And when they end up passing away, we almost immediately have their family trying to find somebody to sue. Oh, well, were they on that medication? If they were on that medication, chances are it could have been a contributor. Well, it probably was, because the guy was a semi-functioning alcoholic and he was 77 years old. And he was on every other medication in the world. But every day we see those commercials. Like, has your family taken this? Have you been wronged?
Received damages.
Call this attorney firm.
Everybody has.
Chip, I appreciate you calling. I appreciate you sitting through the news and sharing that. I agree with you. And think you've something else. Go ahead. Do you have something else to say?
No, I just want to thank you for giving me the time. I've been listening to Chris since he was in Chicago, which is the only reason I tune in down there. Is like I've kind of followed him around the country. He was brave enough to be a conservative radio station guy in the city of Chicago, and that's some pretty big cojones.
That's some big cojones. I get to sit in his chair and fill it while he's gone. So thank you for listening. I appreciate you calling.
Thank you.
That's Chip. It comes back to my question I got to ask is, What are the things, meaningful things we could do? Name one. Give me one thing that we can do that will make healthcare more affordable and better for us. Can you name one? Chip just gave us one. I love it, and I agree with it. I've heard this before, limits and compensatory damages. One of the things I've heard from many medical providers is attorneys, trial attorneys, prosecuting attorneys are part of the problem that cause driving healthcare costs because of all the lawsuits. I've heard that from a lot of different providers. I'd love to hear your perspective. What one meaningful thing would you recommend that we do to our health insurance and healthcare system to make it more affordable, easier to navigate, and better access and outcome on the back end for you and I? Love to hear your comment. The phone number is 800-288-9227. It's 800-288-WBAP. In 3 minutes, we'll get back to your calls. My name is Jeff, Westside Jeff, in for Chris Crock on News Talk 820 and 93.3 FM WBAP. Westside Jeff is my name, in for Chris Crock, News Talk 820 WBAP. Dallas Cowboy game just ended, and the Bengals pulled it out and won. We're talking about healthcare and United Healthcare, the CEO that was murdered in New York. Thank God that Jerry Jones he's a billionaire. He's probably got some pretty good healthcare because he's going to need it after watching tonight's game with the Bengals knocking off the Cowboys in a Monday night fiasco here in Arlington. Pretty interesting. Cowboy season it's over. Come on, it's time to move on. It's time to rebuild. Let's call it rebuild. That's what it is. Cowboys need to rebuild. Call it what it is. My name is Jeff. It's Westside Jeff, and we're talking about the United Healthcare CEO that was gunned down last week in New York City. Just a little while ago, we dropped the notification that the shooter or the alleged shooter has been booked and charged with murder in New York. That's going to continue to play out. But what's interesting to me about this story is the whole angle of this has come out to an era where people across the country are sympathizing with the shooter and making him out to be a hero. I contend what's going on in this country is an entire conversation. This is going to be a national conversation that will last for some time. This is a conversation that people will have no matter whether you're an employee of a company or an employer, whether you're retired and you're on Medicare or you're not. This is a conversation everybody I talk to tells me healthcare is more expensive than ever. Our deductibles are higher. The percentage of my income that I'm paying for healthcare is higher than it's ever been, and the quality of the outcome of that is less. Try getting somebody on the phone to dispute a medical bill. So I ask you this question, and Chip from Florida just called. Thank you, Chip, for being part of the conversation. My question is this. What would you do? Give me solutions. Sometimes in life I like to say, I got enough problems. Forget the problems. We know what they are. Tell me the solutions. Give me one solution. Give me two solutions. What is one or two solutions that you sit at home and you say, why don't they do this? Why aren't they doing this, whoever they is? Why isn't this going on? Give me a solution to the issue of spending more on health insurance, deductibles going up, quality of outcome is less. We're spending $2 trillion more on healthcare. $2 trillion more in healthcare than in 2010 before Obamacare. See, I contend that Obamacare is a part of this conversation. To me, Obamacare is a part of the problem. The law-mandated regulations have given rise to a large problem of insurance market grievances. I contend Obamacare has made it worse. I contend it has not helped. My name is Jeff. It's Westside Jeff. 800-288-9227. 800-288-WBAP. We're spending $2 trillion more in healthcare than in 2010 before Obamacare, yet Americans are not getting healthier. I contend Obamacare wasn't about fixing healthcare. It was about trying to make a single payer system that has led to the frustrations towards insurance companies. The fact is, if the goal were really to make Americans costly health conditions, or if it were about really addressing costly health conditions, it would have been far more simpler and less expensive to boost subsidies for state high-risk pools. But that wouldn't have accomplished the Democrats' actual goal, which is turn the healthcare system into a single-payer system. So my question for you is, what are some steps we could do today, tomorrow, new administration, to make healthcare more affordable, more accessible, and better for outcomes for us? My name is Jeff. It's Westside Jeff, sitting in for Chris Kroc. I want to hear your input. Chip from Florida called and said he's in the healthcare industry over in Florida. He said he worked up in Canada also and up in Chicago. And he talked about RVU. I have to look that up. Relative Value Unit that applied to healthcare. And he said one of the things that would help the healthcare system is attacking the fact that everybody wants to sue. And he said you got to put limits on compensatory damages because a large portion of healthcare costs go into relegation of outcome of potential insurance litigation. So I ask you, how do we fix the system? You're frustrated with healthcare, with health insurance. What would you do to fix it? What would make it better? I can tell you this. I've got an anesthesiologist, buddy. I have narcolepsy. It's a sleep disorder. So if I sound sleepy sometimes, that's the problem. I'm on medication. It's called Speed to keep me awake. Yeah, imagine me on Speed. Unbelievable. But I'm on Speed to keep me awake. At one time, one of the speed drugs I was on a couple years ago was $2,000 per quarter. And I just about went nuts on that. My buddy who's an anesthesiologist said, give me your script. I'll send it off to Canada, and I will get it for a fraction of the cost. It was about a tenth of the cost. Chip just said that drug companies, I wanted to ask you about that, Chip, and I didn't get to it, can't be sued for drugs that they sell in other countries, but they can in America because of compensatory damages. Again, what is one thing that you can do to improve the health insurance, health care system? I want to hear your calls. 800-288-9227. 800-288-WBAP. I got to hit the bottom of the hour news in just a minute with an update on the charges filed moments ago in the court on the alleged shooter of the United Healthcare CEO. Lori Waffen-Schmidt in the newsroom will have that. On the other side of that, we'll continue the conversation and take your calls. Marie from Highland Park, I see you. I see a couple of lines lighting up. We'll get to those calls right after the news. My name is Jeff. It's Westside Jeff. In for Chris Kroc on News Talk 820 and 93.3 FM WBAP. Jeff is the name. Westside Jeff in for Chris Kroc tonight and the rest of the week as Chris takes vacation. Got a note from a junior across Insta that said, hey, Jeff, how about a mandate that U.S. prices cannot be more than 10% more than the most inexpensive country? If our prices go up because of supply and demand, then theirs has to as well. If they do not raise their prices, then ours do not either. Almost sounds like Trump's, kind of a different version of Trump's tariffs. Junior, thanks for your comment. Thanks for your thought on that. We're talking about, my question is this, with regard to the frustration about health insurance. Give me one, give me two, give me three things that you could recommend that would make health insurance more accessible, more affordable, and better, while the outcome and services would also increase. It just seems like there's a real frustration across this country towards health insurance. That's what the issue was with Mangione, who allegedly shot the CEO of United Healthcare. By the way, he was booked and charged with murder. Just moments ago, Manhattan prosecutors filed murder and other charges against Mangione, according to an online court document. He remains jailed in Pennsylvania, where he is charged with possession of an unlicensed firearm, forgery, and providing false identification to police. By the way, the Mangione family has released a statement following his arrest earlier today. It says the family shocked and devastated by Luigi's arrest. Goes on to say that we offer our prayers to the family of Brian Thompson's, and we ask people to pray for all involved. That's the latest on the news story we're talking about tonight. I think this is a bigger conversation than just the killing, assassination of a CEO of a healthcare company. I think it's as much as anything about the problem with healthcare costs and the frustration. And as I said earlier, we are spending $2 trillion a year more right now, $2 trillion more on healthcare than in 2010. That was the year that was right before Obamacare took place. Yet Americans aren't healthier, and Americans as a whole feel they're getting less but spending more. So my question is, how do you turn that around? How do you fix that? Give me two things that you recommend that we could do to make for a better system. Chip from Florida called in moments ago and said limits and compensatory damages. I want to hear yours at 800-288-9227, 800-288-WBAP. Marie from Highland Park. Excuse me. You're on with Westside Jeff. Thanks for holding on through the news.
Well, thank you. I have a couple of suggestions. One is we have such capture on our federal agencies that are supposed to be looking at healthcare or instead looking at pharmaceuticals, and I would suggest that some of the random control trials that they require should be pursuing non-commercial solutions. I think we have a pretty good healthcare system for acute problems, things like broken arms and legs and acute trauma. The place where we're having real problems is in the chronic. And those chronic epidemics have been, humongous. Things like diabetes, things like cardiovascular problems, and also in mental health. And there are a lot of work that is now being done for people looking, for example, at a keto diet, which has been more effective for all of those things: joint arthritis, diabetes, cardiovascular. So if you had incentives for diet and exercise, and so you were incenting somebody to stay healthy rather than misuse their body and then go to the pharmaceuticals, I think you would just cut out a lot of the chronic crap that happens through that long-term abuse. The other thing I would do is a repeal Obamacare, because Obamacare is what's destroyed the actual insurance model. And maybe look at a model that looks a little more like what Medishare does, which is they won't accept you if you're too overweight. And if you are overweight, you pay a higher premium. And they have programs to correct that weight to get you down to a weight where you could, buy into whatever it's not a premium, but whatever they call their shares. So you can't expect an insurance company not to use actuarial tables for risk and still survive as an insurance company. And that's not, again, things like, refusing claims is what they've been forced to because they cannot sort by risk. And we had high-risk pools here in Texas that would work just fine. They would have been much better served by putting their money into those pools than by doing Obamacare. And now nobody has any health care, whether you're on an insurance policy or not. There's a lot of these doctors who said, the heck with this, and they're bailing.
Boy, Marie, well stated and very well thought out. I appreciate your thought. Thank you for calling and thank you for your comments. Says that we have a problem in chronic medical care, diabetes, cardiovascular, things like that, and those are things that we can solve. Marie says diet is a part of that. I can't disagree with you on that. It's kind of ironic that the alleged shooter here was Cotton McDonald's, speaking of healthier diets. But again, at 26 years old, it's a different animal than me at 64. She also says Obamacare has ruined traditional health insurance and really hasn't addressed it and made it worse, and that's part of the problem. I agree with you. I contend that the frustration towards health insurers today in part is driven by what happened and transcended in 2010 with Obamacare. That's part of the problem. My name is Jeff. It's Westside Jeff, and for Chris Kroc, and that's my opinion. You want to weigh in? I want to hear your comment. You can hit me up across social media at Westside Jeff, or call 800-288-9227 like John from DeSoto. John, thanks for listening and thanks for calling. You're on with Westside Jeff. What's your perspective on things you might do to solve part of the problem?
Well, the biggest problem is government being involved in our medical care. When Obamacare came into being, I don't even remember it being voted on by Congress. It came into being by a memo from Obama himself. But what we need to do is get rid of Obamacare. That way we can give it back to the private sector and let them compete for your business like it was in the past. And that in itself will help lower your costs. And yeah, I mean, it's just ridiculous at what our costs are nowadays, especially for chronic conditions. I mean, I have diabetes. I'm not too much overweight because of some of the medications that I'm on and everything, but I'm healthy. But I get my health care through the VA, which is a form of socialized medicine. But I don't pay a lot of those costs that the private sector does. But I think the biggest thing is just getting government out of it. Get it back to the private sector. Let them compete.
I can't disagree with you, John. Capitalism is good, right? That's in essence what you're saying.
Yes.
John, thank you for calling. I appreciate your opinion on that. Thanks for being a part of the show tonight. That was Marie and John. I'd like to hear from you. Weigh in on this. How do you solve our health insurance problem? Marie, loved what Marie said, that we don't have a critical care problem with broken arms, broken legs, and things like that. Car accidents, in essence, and treating that. The problem is more within the chronic medical care, things like diabetes, cardiovascular, things that are somewhat controllable. And our comment is incentivize people to stay healthy, which I get it, I understand it. But Obamacare, consistently I'm hearing, has ruined traditional health insurance, and it's attacked the insurance providers and done nothing to support the system. So I throw out the question, what one thing would you recommend, maybe two things you would recommend, that would improve our system when it comes to health insurance, delivering health care, making it less expensive, more affordable, and better care? I know this, that when I get a invoice from a health provider, when I go to the dentist, when I go to the doctor, and I get a bill, and it takes me 6 months to pay because I'm still trying to figure out how much I owe versus what insurance covers, and the write-offs and all those, and write-downs, and who insures what, that is nuts. I don't understand that. That's part of the problem, the red tape. I'd like to hear your thoughts. 800-288-9227, 800-288-WBAP. My name is Jeff. It's Westside Jeff, in for Chris Kroc on News Talk 820 and 93.3 FM WBAP. Dang, I was just talking to producer Matt and Garrett about the Cowboy game tonight, and it's hard to pay attention to events going on while you're on the radio and thinking and talking, but I had to ask them. I thought I saw just out of the corner of my eye, and I did, Micah Parsons leaving the sidelines before the game was over, before the clock hit zero, out of frustration. And I got to tell you, you're a professional, Micah. Suck it up, Buttercup. You know, I know you're frustrated. I know you're pissed off. I know you lost. You don't leave your team. You don't leave your wingman. You stand there like a professional, and you go off with your teammates. That's a problem. That's going to be interesting talk here in Dallas for the next 24 hours or so. It'll be interesting to see what Jerry has to say later tonight and tomorrow about tonight's game. The Cowboys lost. It's funny, the Cowboys lost on a punt, a Bengals punt that the Cowboys blocked. Interesting. My name's Jeff, Westside Jeff, and for Chris Kroc, I'll be in for Chris all week long. We're talking about the United Healthcare story. There's a real frustration across this country about health insurance, health costs. We're spending $2 trillion more on healthcare than we did prior to Obamacare in 2010. And everybody feels they're paying more, they're getting less. My question to you is this. What one thing, I hear people all the time have an opinion, say, here's what we need to do. Okay, tell me, what do we need to do? What one thing, maybe two, maybe three things can we do that lowers the cost of insurance, health insurance, that makes it a better product for you and me? And we're spending less. Spend less and getting more. What solution do you have? My name's Jeff. It's Westside Jeff. 800-288-9227. 800-288-WBAP. Like Bob from Denton that just called in. Bob, thanks for listening. You're on with Westside Jeff. What's your perspective on this?
Westside Jeff, thanks for taking my call.
You're welcome,
Simply
man.
put, everybody focuses on who pays the costs, and you hit the nail on the head. We're paying $2 trillion more for what? And so we've got to take the costs out of healthcare. So that means lower drug prices. These drugs don't cost as much to market and profit, as evidenced in their lower costs in other countries. And philosophically and culturally, we need to take the profit out of medicine. If you take a look at what doctors and hospitals make, you've got to ask yourself if you're really getting that kind of value in care. And COVID revealed a lot about the medical industry and how it follows a standard and not a custom treatment plan. And so when you take a look at the value you're getting out of paying the medical establishment what we pay and the cost that we pay for drugs, I think that's the first and easiest place we can put some value back into the system.
Bob, thanks for listening. I appreciate you adding your comment on that. Thank you very much. That was Bob from Denton. Randy from Frisco. What's your thought on how do we get more for less?
Hey, Westside. Hey, appreciate it tonight. So, yeah, I just got done watching the Cowboys game. He'll probably say he was going to go get ready for his interview because it sounds like Monday Night Football he was going to have an interview afterwards. I think that's going to be his out for Micah earlier.
Yeah. That's disappointing.
Yeah, because I could tell. And like, as a former, coach, I'm like, these last couple weeks and what special teams have decided to do with the ball after there's been a loose ball on the field absolutely blows my mind. I understand picking the ball up, trying to run it in for a touchdown or not, that's just selfish play. Not covering up the ball immediately on the field of play is selfish. And
these guys are professionals and taught from Little League to do that.
Exactly. That's what you teach them.
Since they played Pee-wee football.
Baby.
Yeah.
So this healthcare thing, so I have a very unique perspective. As a military dependent from the time I was 3 until the time I was 18, I had severe chronic asthma. So I had huge medical situation going on when I was a kid. And I know my dad, since he was in the military, didn't have to pay for that. And I saw the type of treatment I had. So I became a parent as a child, 18, 19-year-old. I had 3 kids by the time I was like 21. Had no insurance and was going to, the community health center for insurance, praying that my kids didn't have to go into the hospital and me be, in debt for the rest of my life. And then after I got done with that, I graduated and went to a company, and whenever my youngest 2 children were born, of my 5 kids, I paid $5 for the first one and like $15 for the second one. See, what happened is when the Affordable Care Act hit, my wife has become a nurse since then. She was pre-med and then decided to raise the kids and then went to be a nurse. In my mind, before the Affordable Care or the Unaffordable Care Act hit, what they would consider a Cadillac plan now, nurses and doctors had back in the day. Whereas if you worked at a major hospital and you're a nurse or a doctor or a tech or whatever, the hospital would pretty much take care of you. So just this 2 months ago or so, I had to have collarbone surgery. And what shocked me was the fact that I got a bill from a third party, not the hospital, but a third party saying that, we've already charged insurance $130 and you still owe us $9 for this sling that I could have gotten on Amazon for like $30. I'm like,
frustrating.
This is absolutely insanity to me. And I'm like, I would love nothing more than the incoming administration to be like, yes, we care about America's health. We want to make America healthy again, but we also want to absolutely reignite the fire of the American ingenuity in this solution to help with the nursing crisis and the healthcare situation in the United States. We are by far a pinnacle in being able to offer solutions to people in the healthcare industry, but not in regards to what we get paid as individuals and how we deal with that. So my biggest thing would be they have to go from the ground up. They have to look at this from the genesis of healthcare and what people are getting charged at their businesses and revamp the whole thing. I don't think there's like one or two things you can do, but they're going to have to, reevaluate where we're at now from where we are at before the initialization of the Affordable Care Act.
Randy, thank you for calling. I appreciate your call, and I agree with you. It's mind-numbing to me that, to your point earlier, that you could have ordered a sling from Amazon if you knew you needed that, and you could have paid a whole lot less and not had that third-party provider. That's the stuff about medical care that just frosts my you-know-what.